Skin is the body's largest organ and often reflects the first signs of internal health issues. One common and often misunderstood skin condition is the appearance of skin tags. These small benign growths, also known as acrocordons, are generally harmless but can cause cosmetic concerns or discomfort. Understanding what skin tags are, who is most at risk, and how they can be treated is crucial for maintaining skin health. This guide explores the nature of skin tags, who is most susceptible to them, and the available treatment options. What are skin tags? Skin tags are soft, flesh-colored, or slightly darker growths that hang from the skin surface. They range in size from 1 to 5 millimeters, although some can grow larger. These growths are connected to the skin by a thin stalk known as a peduncle, making them easily distinguishable from other skin conditions like warts or moles. Skin tags are non-cancerous and typically pose no medical threat, but they can be a nuisance depending on their location or appearance. Skin tags commonly appear where the skin rubs against itself or clothing, such as the neck, armpits, groin, and eyelids, and friction from skin or fabric can irritate them, causing discomfort. Why do skin tags form? Skin tags are most commonly caused by friction, as repeated rubbing of the skin against itself or clothing prompts the formation of these growths. Other contributing factors include age. Skin tags become more common with age, partly due to the loss of skin elasticity. Weight. Obese individuals are at a higher risk of developing skin tags due to increased friction in skin folds. Hormonal changes. Hormonal fluctuations during pregnancy can trigger skin tags, especially on the neck, abdomen, and breasts. Genetics. Family history plays a role in the likelihood of developing skin tags, suggesting a genetic predisposition. Metabolic conditions. Diabetes and metabolic syndrome are associated with skin tag development, likely due to insulin resistance and other metabolic imbalances. Are skin tags harmful? Skin tags are harmless and do not pose a medical risk. They are benign and non-cancerous. However, their appearance may cause cosmetic concern, especially if they are located in visible areas or become irritated from friction. While skin tags themselves are not dangerous, they can be associated with underlying conditions, such as obesity or metabolic syndrome, which should be addressed to maintain overall health. In rare cases, a growth that appears similar to a skin tag may warrant closer examination if it changes in color, size, or shape, as this could indicate a more serious condition. Who is at risk? Though anyone can develop skin tags, certain groups are at higher risk. Studies estimate that 50 to 60% of adults will develop at least one skin tag in their lifetime. Factors that increase the likelihood of developing skin tags include obesity. Overweight individuals are more prone to skin tags due to increased friction in skin folds, particularly in areas like the neck, underarms, and groin. Pregnancy. Hormonal changes make pregnant women more likely to develop skin tags, especially in high-friction areas. Diabetes. Research shows a correlation between type 2 diabetes and the formation of skin tags due to insulin resistance and metabolic imbalances. Age. People over 40 are more likely to develop skin tags, partly due to the skin's decreasing elasticity. Genetics. People with a family history of skin tags are more likely to develop them, suggesting a genetic predisposition. How do you detect skin tags? Skin tags are easy to identify due to their characteristic appearance. They are small, soft, and attached to the skin by a stalk. They are usually similar in color to the surrounding skin, but can sometimes be slightly darker. A physical examination by a healthcare professional is typically enough to diagnose skin tags. If there is any uncertainty, or if the growth exhibits unusual characteristics such as rapid growth or changes in color, further examination may be necessary to rule out other skin conditions such as warts or moles. Treatment options for skin tags. Although skin tags are harmless, many people seek removal for cosmetic reasons or to avoid irritation, especially in areas prone to friction. Several methods can safely and effectively remove skin tags, but it is important to have these procedures done by a healthcare professional to minimize the risk of infection or scarring. Common treatment methods. Excision. A dermatologist uses sterile scissors to cut off the skin tag. This is a quick procedure, and small tags generally do not require anesthesia. Cryotherapy. This method involves freezing the skin tag using liquid nitrogen. The tag freezes, dies, and eventually falls off. This method may require multiple treatments for larger tags. Electrosurgery. This technique uses electrical currents to burn off the skin tag. It is minimally invasive and may leave a small scar. Ligation. This involves cutting off the blood supply to the skin tag using a small band or string, causing it to die and fall off. Self-treatment and risks. While there are over-the-counter solutions for removing skin tags, such as creams or home remedies like apple cider vinegar, these methods come with risks, including infection, scarring, and bleeding. It's always safer to consult a healthcare professional before attempting to remove skin tags at home, especially if they are large, located in sensitive areas, or appear abnormal. Preventing skin tags. Though it is impossible to completely prevent skin tags, especially if you are genetically predisposed, there are steps you can take to minimize your risk. Maintain a healthy weight. Reducing excess skin folds and friction decreases the likelihood of developing skin tags. Wear loose clothing. Tight clothing can increase friction, so opting for loose-fitting garments may help prevent tags in areas like the neck and underarms. Skin care. Keeping the skin clean, moisturized, and free from irritation may help prevent skin tag formation. Conclusion. In conclusion, skin tags are common, benign growths that affect a large portion of the population, especially with age. While they are harmless, many individuals choose to remove them for cosmetic reasons or due to irritation in high-friction areas. Understanding the causes, risk factors, and treatment options for skin tags is crucial for making informed decisions about your skin health. If you're considering skin tag removal, it is always best to consult a healthcare professional for safe and effective treatment options.